health is really made up of different perspectives. Depends on your behavior, if you smoke, if you drink, and so on, what you eat. But it also depends on where you live. Do you have the opportunity to buy fresh fruits and vegetables? Can you afford them? Can you bike down outside of your house? Do you have a sidewalk outside your house?
I think there's a lot of things that are happening in communities that are being underserved that we need to take a holistic approach. It's no longer about just the provision of health care. So much of the individual's health is their zip code, where they live, and the infrastructural things that we need to put in place to help individuals reach their full potential.
It's taken a long time for the levels of chronic disease that we see in our communities to develop, the levels of health disparities that we see to develop. And so we certainly can't solve it on our own, and we shouldn't solve it on our own. So by having a healthy coalition where folks can come together and help prioritize issues and hopefully align our efforts and collaborate, we have much bigger opportunity to make a positive impact in the health of our community.
We have traditionally tried to prevent poor health outcomes with health care. We tried to prevent poor health outcomes with individual behavior change, and now we realize that in addition to those two things, we also have to work to improve the social determinants of health.
Health coalitions are key just by the nature of how they're formed. It's bringing to the table the best that everyone has to offer.
The strength of a community collaboration begins with collaborating and being involved so that we can solve the problems in a collaborative way.
As LiveWell has grown and evolved to impact the needs of all of the county and the community metro area, it's a connection to other organizations when we meet that we wouldn't normally have, and the opportunity to hear what's going on, exchange of ideas and information.
I think the coalition is great because it brings together a lot of really powerful companies and individual stakeholders that can all work towards the same goals, and breaking down those barriers for our community is really important.
Everybody's valuing everybody else's quality of life, and that there's that shared value that we want this place to be inclusive, we want this place to be healthy, we want this place to feel good.
We want to connect the dots with other community organizations. Look at the social determinants. How can we break the cycle? Well, sometimes that's education, sometimes it's housing, sometimes it's employment or employment training, job training.
We can't do it alone. No one can do it alone. So by forming these bonds, building these relationships and supporting each other, that's how we all have access to these resources. So whether it be through volunteer work, through donations, through just helping people find access to other resources, that's how we all come together to help make this work.
I would say right now where we stand, continue to keep doing the work that LiveWell is doing. Include us and spend time with us, and we'll be walking in locked arms in terms of solving some of these issues that plague our community.
This is our opportunity, I think, to do something that is different and meaningful.